Hi, I'm Alana Hippensteel from Pharmacy Times. Today, I'm speaking with Guillermo Rodriguez Navarrete, the founder and CEO with Nutriermo, and Elaine Ladd, the Chief Pharmacy Officer of Pharmacy Development Services, or PDS, in advance of the 2021 virtual PDS conference. Elaine and Guillermo are both with me today to discuss one of the upcoming presentations at PDS this year on the growth opportunities in the health and wellness space for pharmacy. Guillermo, what are some of the ways the health and wellness field has changed during the COVID-19 pandemic? Just kind of some specific elements there. Oh, you're on mute. Sorry,
Could you
Guillermo.
repeat, could you repeat the question?
Sure, absolutely. What are some of the ways the health and wellness field has changed in light of the COVID-19 pandemic and potentially during the COVID-19 pandemic?
Well, they were the ones making us know that we needed to rise the vitamin D levels, the
Mm,
zinc levels,
mm,
the selenium levels. So we sometimes undervalue nutrients. We undervalue sunlight. We undervalue a lot of things just because they are cheap or even free.
mhm.
And not because they are free or cheap, they are less effective. So you don't need an expensive treatment for that treatment to be able to work. Sometimes your own systems are able to fight that virus or whichever other disease even better than some of the new treatments that we can see. Everything that is new, whoever that I have worked in the laboratory, I have worked for 4 years with rats.
Mm,
Those those ladies were early adopters of treatments. You don't want to be an early adopter of a treatment. You don't want to be one of them. I have not seen any of those rats being happy for being early adopters on anything. So sometimes it's better to look back and look at the nutrients and look at that part of the pharmacy that have ancient remedies.
sure.
Ancient means we have been using them for a long time. If they didn't work, we could have stopped using them long time ago. That's what happened with everything, even medicines or supplements or nutrients, single nutrients, whatever. If it doesn't work, it's probably that it get disappeared. So again, creating that sense of the need for nutrients in people, it's probably because that I don't think a GNC or one of those supplement companies or shops have more to do with health than a pharmacist or a pharmacy. So the background of a pharmacist needs to be for that, for just being able to make it better than any other supplement shop and being able to talk even more or even deeper about someone's health in this COVID-19 pandemic. So I think that's one of the things that a pharmacist has done great, recommending helps things that can help even more sometimes than the drugs that you can just get in a hospital. So you cannot, so you don't get to a hospital and you don't need the other drugs.
Yeah, yeah, absolutely, absolutely. Um, Elaine, do you think some of the shift in the public's awareness of the critical role of the pharmacist in healthcare during the pandemic could also support pharmacists' move to a more significant role in the health and wellness space?
Yeah, absolutely. Building on my previous comment, right? COVID, although it created a lot of new challenges in healthcare, it also created some significant opportunities for pharmacists. So while patients were socially distancing, they were also medically distancing. And then they turned to their pharmacists for health and wellness needs. And I know this, having been on the front lines and volunteering, in those community pharmacies. Um, Previously, I used to own my own pharmacies, and comparing the types of questions and the expectations from a patient's perspective today versus 5 to 10 years ago, they're actually different. And so if the public didn't recognize the critical role that pharmacists play when it comes to health and wellness services before the pandemic started, they definitely do now. And I suspect they're going to be asking for a greater access to even more health and wellness services to be performed at the pharmacy, because the pharmacists stepped up, right? They adapted, they mobilized quickly, and as a result, they have gained universal recognition as healthcare providers in the public's, perception, right? So this is a big step for our profession. In Idaho, where I live, the perception, which isn't always the reality, the perception is that there's not enough providers, doctors, nurse practitioners to serve our population. And so I hear this time and time again from patients, from my neighbors, that they're utilizing and they're leaning into their pharmacists more and more to fill this gap. And I suspect Idaho isn't the only state that's experiencing this.